Over the last few weeks, a severe gastrointestinal illness has swept across 34 states. More than 7,000 people have fallen ill, and over 100 have been hospitalized. The culprit is a microscopic parasite called Cyclospora. When ingested, it infects the intestinal tract, causing severe stomach cramps, nausea, and continuous diarrhea. But this parasite has a built-in delay. Once someone eats the contaminated food, symptoms don't actually appear for a full week, sometimes two. This delayed onset makes tracking the origin point an epidemiological nightmare. By the time a patient reaches a clinic, health officials must ask them to reconstruct every single meal eaten weeks prior. Federal investigators are essentially fighting a ghost. When a cluster of illnesses finally emerges, the physical evidence, the actual contaminated food, has long since been thrown away or consumed. To find where the parasite came from, investigators had to look for an anomaly in the data, and they found a massive one in Michigan. The state suddenly became the epicenter of the outbreak, experiencing a highly localized concentration of infections. This graph shows exactly how unusual the cluster was. Normally, Michigan health officials see about 40 cases of Cyclospora in an entire year. During this single outbreak, that number spiked to over 4,000. This extreme geographic concentration gave health investigators exactly what they needed, a viable starting point to track the pathogen backward. Finding a single common denominator among those 4,000 patients would provide the evidence needed to trace the national outbreak back to its source. Michigan health officials put boots on the ground and began conducting extensive interviews. They spoke with more than 1,000 infected patients, cross-referencing their recent diets to find intersecting data points. Initially, investigators thought the culprit might be fresh berries, a common carrier for this parasite. But as they processed the meal histories, they started eliminating those early suspects. Instead, the data firmly pointed toward fast food. The interviews repeatedly isolated one specific chain as the common link: Taco Bell. As a precaution, Taco Bell proactively pulled fresh salad ingredients from restaurants while the investigation continued. Removing the greens stops the immediate spread, but investigators still needed to identify the exact contaminated ingredient to figure out where it originated. The interview data allowed officials to quickly rule out meat and cheese. They isolated the carrier to one specific item: shredded iceberg lettuce. With the ingredient identified, the FDA stepped in. They pulled all supply chain records and tracked the shredded lettuce backward from the local restaurants to its original distributor. The paper trail led straight to Taylor Farms, a massive fresh food distributor based in California. Identifying the supplier for Taco Bell revealed a massive systemic risk. Taylor Farms operates at a scale far beyond a single restaurant chain. This massive supplier has actually been at the center of major multi-state foodborne illness outbreaks before. Back in 2013, a salad mix processed at a Taylor Farms plant in Mexico caused a severe Cyclospora outbreak. That specific incident sickened over 600 people across 25 states who had eaten at restaurants like Olive Garden and Red Lobster. Then, in 2024, the company was linked to a separate E. coli outbreak, this time traced to their slivered onions. Those onions infected over 100 people in 14 states after they consumed quarter pounders at McDonald's. These repeated incidents show that the current lettuce contamination is not a one-off accident. It highlights a recurring vulnerability tied directly to this specific corporate distributor. The company's reach extends deep into the retail market, supplying packaged greens to major grocery chains like Walmart, Target, and Whole Foods. Our modern food infrastructure relies heavily on these highly centralized distributors. A single facility processes and ships produce to thousands of different locations simultaneously. Because of this extreme centralization, a single microscopic parasite introduced at one farm can instantly bypass local safety nets. Within days, it can be sitting on shelves and in drive-thrus across the entire country, triggering a simultaneous, nationwide health crisis.